the virus is very difficult to contain. Many experts studying the pandemic have said one reason for that is because of silent spreaders, people with no symptoms transmitting the virus. That's why it came as a bit of a shock to hear this yesterday from the World Health Organization.
It still appears to be rare that an asymptomatic individual actually transmits onward. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare. And much of that is not published in the literature.
The WHO is slightly walking that back today, saying asymptomatic transmission is still, quote, a big open question. So what should Canadians make of this? Dr. Zain Chagla is an infectious disease physician and associate professor in the Department of Medicine at McMaster University. He joins us from Mississauga. And Dr. Samir Gupta is a respirologist and associate professor in the Department of Medicine at the University of Toronto. He joins us from that city. Hello to both of you. Nice to see you. Thank you very much for your time today.
Oh, thanks for having me.
So on this preliminary question I have around asymptomatic transmission, I think it's a huge point of discussion, Dr. Chagla, among Canadians right now. What can you tell us about what evidence exists about it?
Yeah, so asymptomatic transmission, and the World Health Organization, it was a bit of a misnomer what they used for asymptomatic transmission. So they're referring to someone that throughout the entirety of their illness does not develop a symptom. The evidence behind whether or not that person, when they have zero symptoms for 14 days or however long the illness lasts, then transmits to another person is in question. There is certainly some data that it may happen. Whether or not it's a significant amount of what happens to transmit the disease in our communities is still questionable. But from a personal standpoint, I can't tell if I'm asymptomatic or in 2 days I become symptomatic. So for those of us on the front line, those of us in our communities, it's still very important that we still adhere to the same precautions, as we don't know if we're going to be symptomatic in a day or two and infect people along the way.
Yeah, it's interesting, Dr. Gupta, we had Premier Blaine Higgs from New Brunswick, where, of course, they've had that outbreak in Campbellton. And he was saying one of the things he noted that he would demarcate over the past few days is that a number of people who initially showed no symptoms, eventually 3 days later, even though they were still not showing symptoms because they did such widespread testing due to the outbreak, were actually testing positive. So he was actually seeing, and it's not, I mean, this is anecdotal, but based on what he was seeing, just in that one incidence, there were asymptomatic people who eventually did test positive.
Yeah, I think it's beyond anecdotal. This story started with case clusters. We had reports in very prominent journals of a number of people who appeared to have been infected by somebody who was either asymptomatic or, as Dr. Chagla mentioned, pre-symptomatic. In other words, they didn't know they had it. They eventually developed symptoms, but they spread it in the period of time before they had those symptoms. So that's how the story started. And it was different than what we knew about other novel coronaviruses like SARS and MERS. And that's why it was interesting and surprising at first. And then people went back and did biological studies, and they actually looked for the virus, not just pieces of the viral genetic material, but actually live virus in the nasal cavity of folks who had been asymptomatic, and they found that there was live virus. And so there was biological plausibility to this idea that somebody who has no symptoms has live virus and can transmit that virus. And those studies also suggested that it wasn't a small amount of virus, that what we call viral load was significant in the people who didn't have symptoms. And then eventually we had studies that looked at the proportion of patients with infection who were asymptomatic. And though those numbers have varied, those numbers have been quite large. And so that's where the story played out. It's not entirely clear where the World Health Organization is getting this conflicting information. There are different estimates out there, but this is a very bold statement. It's a surprising statement that they made.
Yeah, can you understand why? I mean, I can't even tell you how many emails I got from people saying, I am so confused. And I think I count myself among them in that moment. And I'm wondering, Dr. Chagla, why don't I move over to you? What you would tell Canadians who are confused about all that information coming at them?
Yeah, I mean, I think this is one aspect, and again, a scientific standpoint of one aspect of the disease, but that doesn't change anyone's behavior. And I think that's the point to get across to Canadians and people around the world, is that even though people can walk around asymptomatically, and again, the evidence of how much disease as a percentage they actually transmit to what's going on in our communities as opposed to people that are symptomatic, we don't know if someone tomorrow becomes symptomatic, and we know they're infectious if they develop symptoms for the 48 hours before they develop symptoms. So it's still very important to maintain physical distancing, maintain those masks, maintain good hygiene, because that 48 hours before people develop symptoms, even though they're asymptomatic, they are shedding still into the environment.
Dr. Gupta, I'm hoping you can weigh in as well on something that I hear from a lot of, in particular right now, Ontarians on, and that is the reopening of so much of the economy that we are anticipating will begin on Friday. I'm hearing from a lot of people who are a bit nervous about it, who are wondering if almost the sort of epidemiology backs up the decisions that are being made. And I know that the government is saying that they're basing those decisions on the advice they're getting from public health officials. But what do you think about the speed at which this is happening? I know it's a regional approach as well that's being taken. Your take on sort of how things are unfolding here in Ontario?
So I share those concerns. I think, the regional approach is very important because there are pockets of Ontario where there haven't been new cases for quite some time, and the virus seems to be well controlled. So that regional approach becomes very important. And we've just heard from BC where they haven't had new cases for several days. We haven't had that level of success in Ontario for various reasons. I think a big part of that is we just haven't had the public health apparatus to really properly, identify people who are infected, but then also trace their contacts and do that work of public health officials, which is to make sure that those folks then self-isolate and prevent the propagation forward. We just haven't had that success. So as we open things up, I think there is a real risk that we will see a second wave. I think that theory will be tested a little bit with the protests that we've seen in the last few days and over the weekend, in that, going forward a week to 2 weeks from those protests, this is a bit of a natural experiment that happened, and we will see whether or not that, major loosening of restrictions that happened as a function of that protest leads to a second wave.
Dr. Chagla, your thoughts on the reopening here in Ontario?
Yeah, I mean, I would agree with many of Dr. Gupta's statements. I think that the regional approach, it makes a lot of sense that the people in Northern Ontario have done an amazing job making sure the disease has not been in their communities, and they should not suffer with the problems that are happening in Southwestern Ontario. I do think there needs to be a bit more transparency about some of those regional decisions on what remains open, what remains closed. I practice in a region in Hamilton that actually has had a relatively few amount of cases, but is in the phase 1 list still. Whereas there's a region north of us in Waterloo that's very open, but is had more cases per week than us. So, some of those decisions are still not totally granular, but I do agree that there is a huge discrepancy between some regions, and certainly we'll have to monitor those regions and the GTA in terms of the reopening plan.
Okay, I'll leave it there. Thank you very much to both of you for your time and your insights and expertise this evening. Really appreciate it.
Pleasure. Take care.
Dr. Zain Chagla, as well as Dr. Samir Gupta. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.